All right. So Jonathan said, Cathy, can you comment on our myopia control patients who are currently in vision therapy? I know it may depend on the specific conditions we're addressing in therapy, but would you recommend in any way adjusting a patient's therapy program and exercises who currently is being treated with myopia control utilizing Ortho-K? So Cathy, what do you think?
So I think that if you have a patient where you're doing Ortho-K, but you also have put them into a vision therapy program because you found that there was a binocular vision issue, the question is that while they're wearing the Ortho-K lens, you're not necessarily going to notice a big shift in myopia. You may, when you test them, see that it's shifted some. But remember, any contact lens, even when we used to do hard lenses, the nice thing was, the patient could stay in the same lens, because even the tear lens, in those patients created a lens in a way that they didn't always need a change in prescription, even though you might measure that. So I do think that it makes sense to give someone the opportunity to develop the best underlying visual skills and abilities possible. And then if you're doing the Ortho-K, the question is, will those patients, although in general the studies have shown that if you stop wearing the lenses, you may go back to the level of myopia where you had been, but not necessarily a lot more than that. Will we see that it helps in some way to keep them from regressing, if not less than where they were, certainly not more than where they were? And I think those are hard studies to do, but I always feel like if I'm doing any treatment, if there's no downside to it and only an upside to it, and really with vision therapy, active vision therapy, there's almost no downside if you choose patients appropriately. There's almost zero downside and only an upside, that someone will have stronger skills that will just be another level of reinforcement against all the stresses that we think are part of the driver of myopia. And, the Ortho-K may be in the beginning because someone doesn't want to wear eyeglasses and they like seeing clearly all day, and that's great. But is it still appropriate to have their system become as strong as it can be? And what will that effect be down the road if they decide to discontinue the orthokeratology?